Hi my friends, it's Linda Esposito from Be Clear with Bronchiectasis. Today I'd like to talk about a very confusing topic, water, drinking water. So I've done other videos on drinking water explaining that I for the most part, use a Life Straw pitcher when home. But I will also use a SteriPen, which is a UV sterilizer, when traveling, and sometimes when traveling, like for example, when we were in Morocco, I just bought bottled water. So I don't usually say this is the way, this is the only way, because it's just not true. There are different situations and there are different approaches. And of course, this is something that you are going to want to have a discussion about with your medical team if you have one. And I know many people don't, but I just want to say that I am an educator and a wellness coach, but I am not a clinician. So this is just for general information. So lots of people say, or lots of providers, doctors, respiratory therapists say, hydrate, hydrate, hydrate. Have you heard that? Hydrate, hydrate, hydrate. And you see that all over social media, and I'm sure the water industry just loves that too. And many of us do just that. We're like drinking, jars of water every day. However, I was very surprised years ago to listen to a webinar from, I just have to clear this message, okay. Listen to a webinar from Dr. Gwen Hewitt, who used to be head of infectious disease at National Jewish Health, which is one of the top lung hospitals in the world. And her big take on bronchiectasis and NTM lung disease was that a lot of it had to do with reflux, with GERD, not non-acid and acid, but let's just call it, for the sake of simplicity, GERD. And jokingly, her name was Gwen. I jokingly tell my clients that she should have been named Gertrude, because it just seemed like everything to her had to do with reflux. Even gardening, you know how we're told not to garden or to wear a mask because of the bacteria, and yes, that's true. But I heard her say that she thought one of the biggest issues was the fact that gardeners are always bending over. And by bending over, you're increasing the possibility of reflux. And her other thing, it was don't overdrink, because if you're gonna reflux anything, you're gonna reflux most likely liquid. Of course, you can reflux particulate matter as well, gaseous matter, but for the most part, it's liquid that comes up very easily. So she never suggested overhydrating. She said, go with your body, if you're thirsty, drink, don't get dehydrated. And recently, Dr. Pamela McShane said something very, very similar. She's at the NIH. She said, we have a faulty mechanism, and all the water in the world is not going to change that. So over drinking is probably not a good idea. So getting back to Dr. Hewitt, she didn't want her patients drinking more than 6 ounces of water an hour. So I know of someone who actually, she was very very good patient, and she set her phone timer or alarm for every hour on the hour she drank 6 ounces. I think I did that for a day. I'm like, okay, this is not me. I'm not doing this. But I am mindful not to gulp down tons of water at one time, especially if I'm doing an activity, if I'm at the gym, if I'm doing yoga, if I'm doing Pilates, just to take little sips, because we don't want to increase the possibility of reflux. With that said, I have a very long history of being hoarse. So certainly, hydrating is important for that as well. And some people have irritable bowel, which I also have, and so hydrating for that's important. So this is something to discuss with your doctor and just understanding the larger issue. Another thing that Dr. Hewitt would recommend is if you know you are going to do an activity, like for example, golfing, and you're going to be bending down, putting the ball in the tee, you're going to be swinging through, and you're going to be in the sun, so you're going to be thirsty and drinking. She said, eat a carbohydrate. So some pretzels, whatever it is, a bagel, piece of bread, because it's only a carbohydrate that's going to act as a sponge and hold that liquid in your stomach. So that's another little tip. The other tip that I like is I have been using Alginates. I've talked about them in other videos, so please look for that. But an Alginate is a substance that when combined with your you take a teaspoon, it's a gel. I like a gel. I think it's also in pill form, but I like the liquid, and it combines with your stomach acid, and it forms like a little raft on the top of your stomach contents. And so that's protective because there's actually something physical on top of your stomach that's going to prevent reflux. And just to be cautious, I often take a teaspoon of an alginate before going to yoga or doing any type of Pilates strenuous exercise. I happen to be more of a savory person than a sweet person, so I've enjoyed using the reflux raft, and I find it effective. But also at the recent patient conference in Berkeley, Reflux Gourmet, another company, gave us these amazing swag bags just filled with these big tubes of their products. So they have, I think it's vanilla caramel and chocolate mint. Don't worry, it's not real chocolate. It's not going to cause reflux or mint. Mint is another thing we want to try to avoid for reflux purposes. But they have also had these little packets, travel packets. And recently, when we traveled to the Pacific Northwest, you went through all my packets, so I'm going to have to order some new ones. But whether it's Reflux Raft, whether it's Reflux Gourmet, or one that's been around for a very long time is Gaviscon. I know some people swear by it. It has to be the Gaviscon that comes from the UK because it has more alginate in it. I do find it effective. I have a problem with motion sickness, and before I get on the plane, before leaving our apartment, I take a teaspoon just to put like a little raft on the top of my stomach contents, because I feel that it helps with nausea. That's kind of my thing, where I often feel a little nauseous, which can actually be a symptom of reflux. So I take a teaspoon and automatically I just feel so much better. These alginates only last for 3 hours, just really when you have your stomach is full, has stomach contents, and they're not going to help you if all of a sudden you get reflux and you want it to go away. It's preventive. It forms a raft. I'm also going to talk about my brushes, but I think I'm going to do another video because I've heard shorter is better. So again, Linda Esposito from Be Clear with Bronchiectasis. I'd love to meet you and do a Zoom consultation. They're really just what I love to do more than anything in the world, is to connect with people in our community and do my best to help them. And of course, I always learn from each and every client. But think about a consultation. Please follow my YouTube videos. I don't make any money from this. I actually pay someone to put these all up and help me with that. So I just love what I'm doing, so I'm really not complaining. But please subscribe to my YouTube channels and please like this video. Okay, now I'm going to do brushes. Bye-bye.